I'm Larry White from the University of Toronto, the Joint Department of Medical Imaging, and I'm going to be speaking with you this morning on MR imaging evaluation of total hip arthroplasties. So as we all know, total hip arthroplasties are an extremely common orthopedic surgical procedure, and it's estimated that over 500,000 primary total hip arthroplasties are performed annually in the United States. Radiographs are historically the mainstay of follow-up and assessment of total hip arthroplasties over time. However, the general indications for cross-sectional imaging of total hip arthroplasties, that being CT and MR, have really grown over time and include evaluation of patients with symptomatic total hip arthroplasties with negative radiographs, as well as use of cross-sectional imaging in the characterization and classification of possible subtle abnormalities seen on radiographic evaluation. In our practice, we've seen a consistent increase in the number of referrals for evaluation of patients with total hip arthroplasties with MR imaging over the past decade. And I think that's leveling off a little bit at this point, but we're still doing a large volume of cases for evaluation of total hip arthroplasties. So, one of the big problems and the reasons why MR really hasn't been utilized over time in assessment of hip arthroplasties and other arthroplasties, including total knee arthroplasties, etc., is related to the metal artifacts that's seen with these bulk orthopedic devices. Artifacts such as the signal loss and intravoxel dephasing seen around metal devices, severe misregistration or susceptibility artifacts, slice thickness variations that occur in the setting of metal and local perturbation in the magnetic field, and poor fat suppression techniques. So there's been, multiple modifications that can be performed to minimize these different